The U.S. is now reporting more than 10 million people have received their first dose of the coronavirus vaccine out of the 29 million doses distributed. This is more vaccine. Mega sites are being opened up across the country. Stephanie Ramos joins us now. Stephanie, now I understand recently you were at a field hospital at UMass Memorial Medical Center, open to handle the surge of patients. Tell us what that was like.
Well, Terry, it was incredible to see an entire hospital operation recreated on the ground floor of a convention center. So this happened in Worcester, Massachusetts. That's where we were to tour this COVID field hospital. They actually reopened last month, but first opened in the spring for the first surge. They shut down for a few months and then found themselves reopening again as COVID cases started to rise in that area, as we're seeing across the country, really. But an incredible operation. The staff there, they really have everything that they need. X-ray machines, respiratory devices, all of the equipment that they need. They've got copper lines that run from each patient room that provides oxygen if they need. They have an ICU area in case any of these COVID patients become critically ill. They can stay in that area until they're transported to a hospital. They also have a lounge area. A reminder is that all of these patients have COVID, so they can all hang out with one another and walk around and just they're on the road to recovery. So they have a tremendous space to care for these COVID patients. And we spoke with the medical director of the COVID field hospital, and he talked to us about what it was like to set this up and how they kind of had a playbook already. Take a listen.
Well, I think many of us anticipated that there might be a second surge. We've seen that the second surge has been much worse than the first, at least in this local area. So we were gearing up to reset this up. We had a little bit of a playbook this time, so it was a little bit easier in terms of just thinking through the logistics of how to get the oxygen piped in and all the IT infrastructure, hire all the nurses, the providers, and everything like that. But it's, everything you see around us was built from the ground up. This was a blank, empty space when we started 6-7 weeks ago.
So far, they've treated about 400 COVID patients since they reopened in December, and they say they will stay open for as long as they're needed there in Worcester, Massachusetts. Terry.
All right, Stephanie Ramos, a sign of the times there for sure. Thanks very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.